with neck pain. There are so many different people that you can go and see out there: physiotherapists, chiropractors, osteopaths, pain specialists, spine surgeons. Who's the right person for you to see, and how do you find out? Well, we'll try and cover that in this video, and hopefully this guide will help you. My name's Anthony Gosh. I'm a consultant neurosurgeon and founder of the Spine MDT, the only spinal organisation bringing all professions of spine care: osteopaths, physios, chiropractors, pain specialists and surgeons in one organisation to find the least invasive solution that gives you the longest lasting result. You can visit our blog page on the link in the description below for useful information to help you manage your spine, and also click subscribe to keep up to date with weekly videos we post to help you manage and look after your spine. Check out our previous video on a guide to different professions managing back pain and spine disease. That gives you an idea of what all these different people do. Also, if you visit the website, there's a free guide you can download on managing your back pain and neck pain as well, and the different types of professions that treat these conditions. Okay, so if you experience neck pain that's come on after an injury, a big accident, a road traffic accident, high velocity injury, or a fall, then I think you need to seek medical advice straight away to exclude things like fractures or dislocations in the neck that can put your spinal cord and nerves at risk. So after any severe injury or trauma to the neck, seek medical advice straight away. This is not something for the high street osteopath, chiropractor, physiotherapist. If with your neck pain you're starting to experience pain going down the arm with numbness or tingling, that could be a sign of a trapped nerve in the arm. It's important you get assessed properly to ensure there's no weakness of the arm. If the symptoms have been fairly recent, have come on gradually over the last few days or few weeks, the likelihood is that will settle down anyway. So seeing a chiropractor or an osteopath or a physiotherapist can be helpful in making a basic assessment, carrying out some manipulations in the neck, and giving you some exercises may help with that. However, without a scan, be very careful if anyone offers you any weird or aggressive manipulations of the neck. Sometimes these aggressive manipulations can push the disc out further, cause damage to the nerve or even the spinal cord. In my opinion, a physiotherapist, especially people that have had experience in neurorehabilitation, will be very good here at making a really good assessment of your neurological function. Equally, see a doctor or a spine surgeon for that. But I think for a basic assessment, a physiotherapist should be fine for that. If you have got weakness in the arm of your grip that's been found either by yourself or whoever's assessed you, then it is important to get a scan. Or if there's no weakness but the pain has persisted, is not getting better, then it's time to scan the neck, and that's something a spine surgeon can arrange. The same applies if you start to notice weakness in your legs, difficulty walking, unsteadiness of your feet. Basically, any kind of dysfunction of your upper limbs or your lower limbs that kind of needs urgent medical attention and a scan. Preferably a spine surgeon. In our practice, we can get a scan done very quickly for you. Now, for general aches and pains in the neck that are not really spreading anywhere, i.e. down the arms, or not causing any neurological symptoms, simply confined to the neck area, even if it spreads up and down the neck a little bit, it's usually muscular, or usually down to wear and tear changes in the neck. This can be aggravated by certain movements you make. It can affect your sleep, and it's often brought on by poor posture, i.e. sitting over a laptop as I'm doing now, recording this. Chronic use of computers, being sat at desks, looking down at screens, mobile phones, things like that tend to cause it over the years, but then it becomes a bit more persistent. In general, it's highly unlikely you're going to need any invasive treatment for this that a spine surgeon will do. So for that, I think it's perfectly reasonable to see an osteopath, a chiropractor, or a physiotherapist for this. In the more acute setting, where you've woken up and the pain is quite severe, quite intense, as long as you haven't got any of those neurological symptoms I described earlier, having some kind of adjustment, manipulation to the neck can be helpful to just get you out of that acute phase. But thereafter, it comes down to improving your overall posture, as well as strengthening some of the deep muscles in the neck. So the stuff that the chiropractor can do and the osteopaths are quite similar in terms of adjustments or manipulations. There's some variation in how they do that. So they can be useful people to see in the acute phase. But for more chronic pain, I think seeing a physiotherapist to teach you some resistance exercises is very useful. And thereafter, going a step further for maintenance, and I recommend this on all my patients, is your own exercises that you can learn to do later on through a Pilates class, for example. So, other scenarios where I think it's important to see a doctor, such as a spine surgeon, rather than an osteopath, physiotherapist, or chiropractor, are if you've had a previous history of cancer and you've started to develop pain in the neck that's persisting, usually worse at night. It's very important to get that assessed and possibly scanned, but by a doctor or a spine surgeon. Also, if the pain is just becoming more and more severe despite all these treatments you've been having, and you possibly have a fever, let's say you've had a fever that's going along with it, that's really important to get it scanned as well. So seeing a doctor or a spine surgeon in that scenario is very important. So who you go and see, really, in summary, broadly comes down to whether you need a scan or not. If you've recently started experiencing pain in the neck, and there's no pain radiating down the arm, there's no recent history of cancer, it's not getting worse, it's not severe or intense, then usually a physiotherapist, chiropractor, osteopath will be fine. And as I mentioned, in a very acute setting, the manipulations, adjustments done by a chiropractor and osteopath can be helpful in the acute setting. And in the more chronic setting, the exercises the physiotherapist can teach you can be more helpful. If you start to experience pain shooting down the arm with weakness or numbness in the hands, and same in the legs, that's when you probably need a scan. Likewise, if you've had a recent history of cancer or the pain in the neck itself is just getting worse and worse, that's when you probably need a scan. And in those scenarios, it is best to go through a doctor or a spine surgeon. So what sets us apart at the Spine MDT is that we order a more coordinated service. We're one of the few organisations that have all of these professions in one organisation. So chiropractors, osteopaths, physiotherapists, all led by a spine surgeon, so that your care is coordinated. We offer a one-stop clinic where we can get some very basic information off you briefly and help you decide who you need to see, and we can coordinate and oversee that care through our one-stop spine clinic, which also includes a scan if needed. Please learn more about it by calling on the number below, or visit our website to find out more, or email us. I hope you found this video helpful. If you need any help, please get in touch. We'll be very happy to help you. Thank you.